Well, my name's Dr. Lederman, and I'm here with...
DERICK King.
Okay, Derek. So how do we know each other?
Okay, I think in 2020.
Years ago, 2020, you came here and...
Yeah, I was diagnosed with, I did a biopsy for prostate cancer.
And you had a positive biopsy, right?
Right.
And it was a more aggressive cancer. It was a Gleason 7 cancer, right?
Yes.
And we didn't do the biopsy, so that was done elsewhere. Do you remember that?
Yes, sir.
And do you remember the doctor who did the biopsy?
I can't remember.
It was a surgeon. Do you remember what, you probably asked him what advice, what kind of treatment should you have for Gleason 7 cancer? What did he tell you to have for treatment?
Well, they sent me to Kings County Hospital. They wanted to do surgery. They offered me two options, surgery or chemo.
Okay, so you offered surgery, and did the surgeon want to do surgery on you?
Yeah. I said I don't want to do this surgery because I don't. After I go online and check out, and it tell you that if you do surgery, then it's like your life gone.
Well, which part of your life is done?
Your manhood is gone.
Your manhood is gone.
Right.
So you're worried that if you had surgery, in fact, there's data to show that if you have surgery, most men lose their erections and lose their sex life, right?
Right.
Did the doctor tell you that? Did he tell you exactly that?
Yeah, they explained certain things to me, but then I always listen to the radio on the Jamaica radio station, and I see Dr. Lederman always.
So we talk about the options, right?
Yeah.
So you didn't want surgery, you didn't want to lose your sex life, right? And you had the treatment, you came with a Gleason 7 cancer, so it's a more aggressive cancer.
Yes.
And actually Jamaicans and Caribbeans and black people have the highest rate of cancer and actually the highest rate of dying from cancer, right?
Right.
So you knew about that.
Right.
You probably have friends from Jamaica who have prostate cancer.
Right. So then I came to Dr. Lederman, and he explained everything to me.
Were you satisfied with that?
Yeah.
Why'd you come here and not to the big hospital?
Because I said, let me try. Let me come here and see what, because first when I heard about Dr. Lederman, I said, this guy may be expensive.
Yeah, very expensive. Right?
So I said, no, I don't want to, let me check and see. Then I called. And he told me to come in. So
and we take your insurance, right?
Right.
So it was actually less expensive than a hospital.
Exactly.
It's less expensive than a hospital. So you came here and we met.
Right.
And what did you think at that time?
And then after you explained everything to me, and you said, what you want to do? And I said to you, I'm okay with it. I'm fine. So, and you said, so when you want to start? I told you I will start there. I think it was the Monday or something like that. And you said, why not start today? And I said, okay. You say you will build a cast.
Right. Was that painful?
No.
Was anything we did painful?
No, nothing.
Did the staff treat you well?
Very nice.
So years ago you had the treatment, right?
Right.
And then your PSA has gone down to 0, right?
Right now my PSA is 0.
The PSA is 0, and the cancer never came back.
Never came back.
And you never had surgery, right?
No.
And you never had chemo.
No.
And you never had hormones, right? Just the radiation.
Right.
And what side effects did you have from the radiation?
0.
How's your manhood? Are you okay?
I'm fine.
You're A-okay. Your women are happy, you're happy, everyone's happy.
Exactly.
So you're satisfied.
Yeah.
And what was your experience like coming here for treatment?
Oh, the staff there are very, very nice.
Did anyone hurt you or tell you things that weren't true?
No, everything is good.
Everything we told you was true?
Right.
And so now, why are you here?
I'm here now from my knee.
So tell us about your knee.
I could hardly bend my knee.
How long have you had trouble with your knee?
It's been years now.
Years?
Yeah.
So many years?
For many years.
Have you tried medicines or injections or surgery or seeing other doctors?
I went to the doctor and they told me it's arthritis.
And did they give you any treatment or recommendations?
Nothing.
Did anyone tell you about low-dose radiation for arthritis?
No.
How'd you learn about it?
Well, when I came here, I saw it I saw one of your picture on the wall.
So you saw a picture, you learned about it.
So I said, wait.
And I gave you a book.
I said, Dr. Man, do this stuff. So I said, let me check it out.
And they gave you a booklet and information, right?
Exactly.
And you read that and you learned about that.
Yeah.
And we did it, pictures of your knee to make sure it was arthritis.
Right.
And now you finished the treatment, right?
Yes.
And what's your experience about the knee?
Right now, I think I could bend my knee and I have no problem. It's not hurting me.
So the pain has gone away?
The pain gone.
And the movement is better?
And the movement is good.
Is any side effects that were bad?
Not so far. I have no problem right now.
And how did everyone treat you?
Very good.
So what's your advice for people who have arthritis?
Well, I can recommend Dr. Lederman to anybody.
Okay, so you're satisfied.
Very satisfied.
And what's your recommendation for people who have prostate cancer?
Come and see Dr. Lederman.
So right now we're 2 for 2,
Right.
right?
2.
2 for 2. The prostate is in remission.
And the arthritis.
And the arthritis is gone away. The pain's gone away, right?
Exactly.
All right, so any questions you can think for me? Anything that we didn't answer for you during your time here?
No.
Okay, so we're going to see you back for the rest of your life, right? We're going to make an appointment today for the rest of your life,
Right.
the next appointment.
Yeah.
Do you have any questions or information or advice you'd give other people?
Well, I'm very satisfied with the treatment here. And the staffs are very, very nice.
So everything was A-okay?
Okay. When you come here, you could go back to work, no problem.
No, some people don't like to go to work. All right, God bless you and thank you.
Thank you, Dr.
Okay, God bless you.